Okay. Good afternoon. My name is Charlotte Hooper, and I'm Director of Communications here at Terros Health. I'm excited to welcome everyone to our event, Heart Health and Nutrition. Terros Health is honored to be co-hosting this event with the American Heart Association. Our panelists today are Dr. Reshmaal Gomes and Jason Pawloski. Dr. Gomes is a cardiologist specializing in preventive medicine, general cardiology, and women's heart disease with a special interest in imaging. She currently practices cardiology at Phoenix Heart, located in Glendale and Goodyear. Dr. Gomes completed her medical education at University of Liverpool in the UK. She completed her fellowship in cardiovascular medicine at University of Connecticut Health Center and is board certified in cardiovascular disease and nuclear cardiology. Dr. Gomes is currently serving on the board of directors of the American Heart Association Phoenix Division. Jason Pawloski is a registered dietitian nutritionist at Terros Health, working with patients across the Phoenix metropolitan area. He has broad experience working with patients in different specialty areas, including cardiac rehab, endocrinology, bariatrics, cancer, child rehabilitation services, and family medicine. In 2017, the Academy of Nutrition and Dietetics recognized Jason as the Young Dietitian of the Year. Jason is in the process of completing a book on nutrition and is an avid hiker. He also shares that beyond all the fruits, veggies, whole grains, legumes, nuts, and seeds he eats, he does occasionally enjoy eating pizza, french fries, cookies, and donuts. Our panelists are going to share their slides and insights. When they are done presenting, we will open up our Q&A. If you have questions during the presentations, please feel free to submit them. We'll be sure to return to them at the end of the presentation. All right, Dr. Gomes is going to get us started today.
Hi, everybody, good afternoon. I'm going to talk to you today about heart disease and stroke and the effects of the pandemic on this and the new initiative that American Heart Association has that's called Don't Die of Doubt. So heart disease is the #1 killer of adults in the United States. So what does that mean? That equates to about 610,000 people dying in the US of heart disease, or that's about 1 in 4 people. Stroke, that's the #5 killer of adults in the US, and the #1 cause of long-term disability. So what can we do? Remember that 80% of deaths from heart disease and stroke are preventable. So what do I mean by that? So remember the risk factors for heart disease and stroke? We all kind of heard about it, but just to kind of put them together. The main things are, think about smoking, diabetes, poorly controlled high blood pressure, diet, lack of exercise, and drinking alcohol. Now, I know Jason's going to talk to you about diet, so I'm going to leave that to him. But when we focus on the other things I mentioned, all of those are risk factors. It doesn't mean that we can cure them, but there's a lot that you and I can do together to make them controlled so that we slow the progression of disease. Exercise. Well, it doesn't have to be going to the gym every day or having a personal trainer. It can be as little as going for a walk at least 30 to 35 minutes a day or at least 5 days a week. Weight loss. That can be slow progression of loss of weight, not sudden fad diet. Losing your weight about 10 to 15 pounds, watching your salt intake, and exercising can actually lower the top number of your blood pressure by about 10 to 15 points. Diabetes, diet, exercise, but also following up with your provider, following up with your A1C, and together making the control of the diabetes better. And going back to blood pressure, teamwork again, lifestyle modification, and optimizing the medications you're on to make that blood pressure control for you, for your age, and the other risk factors that you have. Alcohol. Long-term again, not suddenly stop it, but slowly cut down the amount of drinking, and if you can, minimize it completely. Smoking. Nicotine has been shown to be a big risk factor both in all kinds of heart disease and with stroke. Again, there's more and more new ways of getting all of us help to how to cut back on that, again, to your provider. So 80% of deaths from heart disease and strokes are preventable. Now, important what's happened of recent is the COVID pandemic has hit us all. Surprisingly, what we have noticed is the emergency room visits have actually gone down by nearly 42%. About half of the individuals are more afraid of contracting COVID-19 than suffering from a heart attack and stroke. So the American Heart Association has an initiative that they've taken nationwide called Don't Die of Doubt. What's it about and why? So remember that hospitals are following infection control protocols to sanitize, social distance, and keep infected people away from others. Calling 911 immediately is still your best chance of surviving an emergency. The emergency room workers, they've been shown what to do even when it looks like it's chaotic. Year in, year out, heart disease is the top killer worldwide. Fast care is the key to survival. Now, a lot is being said about things that may or may not be true. So let's run through some things that we may have heard our family or friends say, and things that we've heard on the grapevine. I'm not sure if this is a heart attack or stroke. It's probably nothing. I'll be fine after I have a nap. Let's be blunt. You can die from that. Every minute counts in an emergency. Symptoms like chest pain, pressure, discomfort in both arms, neck, jaw, or shortness of breath are symptoms of a heart attack. Sudden face drooping, weakness in an arm or leg, difficulty speaking, these are all signs of stroke. Any of these symptoms require emergency care in the past, say 5 months ago, and it needs it now as well. You've heard this, right? I don't want to bother the busy emergency medical services. Remember, the professionals, they are trained for years to help people with heart attacks, strokes, and other medical emergencies. They're committed to saving lives, whether it's during COVID or before COVID. You need to be seen in the emergency department that's qualified and capable of taking care of cardiac and stroke emergencies. And the people who can work there need to see you. That was true any day, and it's true now during COVID-19. I've felt this. I'm afraid of getting coronavirus. I'll be safe at home. We've all feel that at some point. But remember, calling 911 at the first sign of heart attack or stroke could save your life or loved ones. From dispatchers to the first responders, the emergency room system is prepared to help you safely and quickly, even during this pandemic. We're all trained to avoid spreading of germs. Yes, you'll see us all in face masks, face shields, gowns, but that's what it's there for, to help prevent the spread of germs. Hospitals are following the protocols, sanitize, social distancing, and a lot of our emergency rooms, we keep our patients with possible COVID or COVID separated out. So they're in different areas of the ER. If we have to do a cardiac cath on them, we use certain facilities. ICUs are separated out at this time. What if somebody says, I'm afraid of being alone in the hospital during the pandemic? Yes, nobody wants to be alone. It's difficult. However, there's no real getting around it. It's better to be alone for a week or two than to leave your family forever. Heart attacks and strokes can be deadly or lead to serious disability. Remember what we said at the very beginning, the #1 killer in the US. And disability from strokes is the #1 cause of disability. The sooner you get help, the better. And the more likely you'll be to live to see your loved ones again. How about this one? I can get to the hospital and get treated more quickly if I drive myself. Is that true? No, because heart attacks and stroke treatment begins in the ambulance. As soon as you're in that ambulance, the paramedics get your EKG and transfer it to the emergency room department. If it's a true heart attack that needs immediate help, the hospital ER will call the cath lab crew, which includes the interventional cardiologist, the cath lab, all the team. And by the time that ambulance gets to the ER team of doctors and nursing providers are there for you. And then the cath lab team is there, and it seems seamless. Why is it so important? Because time matters. Those arteries, if they're blocked up, They need to be opened up soon. The reason being, the longer you leave it, the muscle to the heart dies. And that's what we're trying to prevent. What if somebody says, I don't speak English? I can't call 911. Actually, you dial 911 and simply say stroke, Spanish interpreter, or heart attack, Spanish interpreter. Most of the EMS dispatch centers use a language line that will help them respond to call in Spanish and other languages. So if you know family or friends, just let them know. They might have never heard of that. Stroke, Spanish interpreter, heart attack, Spanish interpreter. So what are these symptoms of stroke and heart attack that we worry about? What are those warning signs? So the warning signs can be many. I know we all hear about chest discomfort, so let me talk about that first. So it can be chest pain, pressure, squeezing pain or discomfort that's in your chest. Some people, it's a feeling that goes up their neck, up their jaw, or down their arm. But there are others that don't have any symptoms of chest pain or pressure, and what they have is that squeezing arm, the jaw pain, or the arm pain. Sometimes it's happening where it's coming and going. It could be that they're doing something that they've normally done, like, for example, you're making your bed. You do it just fine 2 days ago, but all of a sudden you're getting arm squeezed when you're doing that. Don't put it off. That could be your sign of a heart attack. Remember that women actually have more atypical symptoms. What do I mean by that? That means that unlike having the chest pain or pressure, they are more likely to have that arm pain on exertion, or suddenly get short of breath, or feel cold sweat with that short of breath when they've just done something. Those can be the symptoms of the heart attack that you're having. Don't put it off. Don't say it's because I've just laid on that arm. Find help. Other signs can be things like cold sweat, nausea, or lightheadedness. Stroke. What are the symptoms or signs of stroke that we're worried about? One important thing to remember is the acronym FAST, F-A-S-T. FAST, F stands for face drooping. Look at their face. Is the face drooping on one side, or do they feel numb? Ask the patient to smile. Can you see all the teeth, or is it drooping on one side? Arm weakness. A is for arm weakness. Is one arm weak or numb? Get them to put their arms up. Put the arm drift downwards. S is a speech difficulty. Is their speech slurred? Are they unable to speak? Are they hard to understand? Ask them to say something simple like, is the sky blue? Are they able to repeat it correctly? T, the time to call 911. If the person or if you have any of those symptoms, go straight away and call 911 and get them to the hospital immediately. Make that call. Call 911. Remember, don't die of doubt. Call for help. Remember the symptoms of stroke. Acronym FAST. F-A-S-T. Face. Any drooping. A. Any arm or leg weakness. F. How's their speech? T. Call for help. And for heart attacks, symptoms of chest pain, pressure, sudden short of breath, sudden feeling of sweaty, call for help. Call 911. It may be the COVID pandemic time, but we're all there for you. Don't die of doubt. Thank you again.
Thank you, Dr. Gomes. We're going to move to Jason's slides now. Just give me a second to pull those up. And Jason, just want to make sure that you're unmuted.
Yep.
Okay. One second. I think I'm ready here. Okay. Oh, no. is not the right slide. Okay, are you all able to see the slides now?
Popped up on my end.
Okay. All right, I'm going to mute myself and let you lead through the slides, Jason, so just prompt me when you need to change.
Okay, so I think that would be one of the last slides. If you could maybe start at the first, please. All right. Good afternoon, everybody. I'm glad to be here with y'all and great information to more about health and what that really means. So we'll talk a little bit more about that. Go to the next slide, please. We go to the next slide.
Yeah, I have it on the next slide. Is there a delay?
A little bit of a delay. It went second. I think we're maybe on the third. Back to the second. Okay.
Okay.
All right. So some of the points I wanted to talk about today. I want to talk a little bit about what matters most in a heart healthy diet, because it's really not a specific diet I'm talking about here, whereas I try not to very often ask people to follow rigid diets or something too specific, as I find that a lot of times that is either maybe not sustainable for a lot of folks, or maybe we might do really well for a short amount of time and then sometimes get frustrated and maybe forget it all if we try too restrictive of a diet. So we're just going to talk about some points about what is important for overall heart health, but we'll get a little bit more specific about the different types of fats so you can get to know your fats that you're eating and understand that there's different fats in the diet that have different effects on our heart health. So it's important to be aware of. But we'll also talk a little bit about some different effective dietary models that we could use to eat more of a heart healthy diet. Then we'll talk a little bit about different types of carbohydrates, because sometimes if we eat too much of the less healthy types of carbs, they can sometimes have adverse effects and not just raise our blood sugar, but they can have effects on our triglycerides, which is another thing that doctors look at to monitor the heart health and see the health of kind of your how strong the heart is working and so forth, and trying to keep your risk for disease later on in life at a minimum. So talk a little bit about the carbs, and we'll finish up talking about setting SMART goals and how we'll try to focus on, when it comes to diet changes, trying to target maybe one or two key changes is what I find that most people tend to find success with in the short run. And then maybe that means a month later we follow up and we set a couple other goals and we build on that. So we'll talk a little bit about the importance of setting SMART goals. Thank you. All right, so a few points we want to take a closer look at, like I mentioned, is getting to know your fats and where the fats in the diet come from, what types of foods provide them, but more importantly, what types come from different foods. We'll take a closer look at. But also another point for a heart healthy diet is that we're choosing more of the wholesome carbohydrate foods. So here we're talking about whole fruits, whole vegetables, whole grains. That word legumes, it's just a fancy word for beans and lentils. In case maybe you haven't heard of that, it's just the different peas or beans or lentils that fit into that group considered legumes. Now, all those foods provide carbs, carbohydrates, but they're also rich in fiber. So they tend to take longer times to digest. They, in general, tend to be more nourishing to our bodies. So those are more of the heart-healthy types of carbohydrate foods we should be focusing more on in a heart-healthy diet. And then, as you see the point last there, is to avoid excess sodium, also commonly referred to as salt in the diet. But a lot of times we tend to eat too much of the processed foods, or maybe if we eat a lot of fast foods, whereas those foods tend to have a lot of sodium put in them, and too much of that sodium is linked to higher blood pressure, which is just one measure that doctors look at to monitor the health of your heart health in general. But a quick note about one reason why we should be getting more of those fruits and vegetables in the diet is because they're rich in potassium and magnesium. And if we have a better balance of that sodium and potassium, magnesium, that helps our body to regulate, control those sodium levels when we get plenty of those potassium and magnesium rich fruits and vegetables in our diet. A couple other general points on a heart healthy diet is think about your proteins, because we all need proteins in our diet, but for the large part, a lot of us are eating more proteins than we really need in a healthy diet, particularly when it comes to meats, because meats are very rich in protein, so a little bit of meat goes a far way in terms of nourishing us and giving us enough protein. But think about the types of meat you're eating, because try not to be eating too much of the high-fat meats or too much of the processed meats like bacon or sausage and pepperoni, whereas we ideally want to choose a little bit more of the lean proteins. So this might be maybe more chicken breast or turkey instead of beef for some folks, maybe a little more fish into the diet, sometimes choosing more plant-based proteins, and that could mean just more beans, more lentils, more peanut butter, almonds, nuts and seeds. Those all give us protein in the diet, but they're also, a lot of those foods tend to provide more of the essential fats that we also need in the diet, instead of too much of the unhealthy fats, which some of the red meats and more of the processed meats tend to be richer in those unhealthy fats. So can't forget about water and hydration, and this is particularly true for those of us living in Arizona, and if we spend a lot of time outside, we're losing a lot of our fluids. So just be aware that we want to make sure we're not only drinking a good amount of water, but some folks that maybe do sweat a lot, maybe some folks that maybe work outside, or they're sweating a good portion of their time, maybe a lot of exercise, then that person might need to not only drink a lot of water, but a little bit of Gatorade or a sports drink to that person could help replenish some of those electrolytes they've lost. Whereas if you're not that active and you don't do much exercise or work outside, you probably wouldn't need Gatorade or any sports drink, and plenty of water and fruits and vegetables is going to be fine to keep you hydrated for the most part. And try to limit the juices and the sweet drinks, because it's okay to have a little bit of a soda once in a while, or a little bit of juice is perfectly fine. But if we take too much sugars day after day, meal after meal, sometimes that can also have an effect on our triglycerides, and that is something to watch for, and just be mindful not to drink or eat too many sugars in the diet. So we're moving on. We're taking a closer look at the different types of fats here. Sometimes this might be referred to as I know in the past, American Heart Association had referred to as the good, the bad, and the ugly. We can also refer to as like love it, limit it, or lose it. It's kind of another way to look at these three here. But just to kind of understand the difference here, the good, or also referred to as essential fatty acids, these are types that we need in our diet for good heart health, for brain health. They're just important for overall health. So these would include more of the unsaturated fats that we tend to find more in fish, nuts, seeds, avocados, olive oil, and various other foods with those unsaturated fats. Particularly healthy is the omega-3s, and that's one type of essential fats that many of us just don't eat enough in our diet. So that's one thing to be mindful of, and try to get more of those sources of omega-3s and other essential fats in the diet. Moving on to what's sometimes referred to as the bad, and I put in large amounts in parentheses here because it's perfectly fine to have some saturated fats in the diet. It's perfectly fine to eat some meat, some red meat, but in general, most of us in America, we tend to eat too much of these saturated fats, and that can be a problem to heart health. So just be aware of, you know, when you do eat a lot of fatty meat, you might, like we mentioned earlier, maybe consider trying some leaner cuts of meat, maybe just have smaller portions of meat, but then bigger helpings of vegetables. So you're taking in less of those saturated fats when you enjoy that meat, for example. Now notice on the bottom, a little bit different of a section here. The worst types of fats in the diet are going to be considered trans fats. They're also referred to as hydrogenated oils. From my understanding, we are in the process of taking these out of a lot of foods in the market, so that's the good news. But I don't know how much they're still in products or how commonplace they are nowadays compared to a few years ago. But mainly with these hydrogenated oils, we're talking about the deep fried foods or a lot of like the packaged baked goods and donuts, cupcakes, and a lot of the pastries and sweet processed goods like that. I think we might have a couple more slides here. Okay. So we'll talk a little bit about the different types of carbs here, because ideally we want to choose more of those wholesome carb, high fiber types of foods that I mentioned earlier. So those more complex carb foods are going to be, they're going to provide a little bit more fiber or protein or maybe a little bit of fat in there. So for example, when we choose more of these complex carbs, you know, this could be like maybe a side of beans, you know, because the beans has protein, there's fiber, carbohydrates, and then we might add a little bit of fat. So that carbohydrate is going to take more time to digest. It's going to have more of a stable, controlled effect on our blood sugar as compared to maybe we eat more of those simple carbohydrates that lack that important fiber. Unfortunately, many Americans, we eat too much and we load up on these low fiber, more processed types of carbohydrate foods. You know, so it's okay to once in a while enjoy that donut, have some cupcakes, a little bit of white bread, all right, but it's better to choose more of those whole grains. But a quick word of caution, just because sometimes people add too much fiber too quick to their diet, particularly when we go from a lot of the refined grains in the diet to too much too quick of those more healthy whole grains, that can be uncomfortable. That can result in some bloating. So just be mindful not to add too much fiber to your diet too quick if you don't already eat much fiber in your diet. Gradually introduce those foods over time, and then you'll more likely feel better about that and tolerate it fine. And then, okay, so we got a couple models I wanted to just take a quick look at. So notice that I tried not to use diets, the word diets here, because again, they might be labeled as diets here, but it's really not a specific diet it's asking you to follow so much as what these examples are looking at. The DASH diet, Mediterranean, anti-inflammatory, whole foods, plant-based. These are just dietary models or patterns that we might use that take into consideration those points we just talked about. So you can consider all of these examples heart healthy diets. They're good models to look after. That last one mentioned might not appeal to everybody. Well, frankly, all of these might not appeal to everybody, and that's okay. But I just wanted you to see some common ground, and you can look at different examples and see that all of these examples include various vegetables, fruits, whole grain or lean proteins, and essential fats, and so forth. So some good models you might look into and see if they help you. But that last one, the whole foods plant-based, is more geared towards vegetarians or vegans, because that one's more strictly plant-based foods. So that one would not appeal to everybody, but could be a good model for some folks to follow. And I think we got one more. Okay, we're going to finish it up here with SMART goals, because I understand that as we talk about this healthy diet for some folks, this can get a little bit overwhelming. So I try and always finish up my conversations when I do work one-on-one with people, is how can we target one or two key changes that you feel ready and you want to improve on at this time? So try not to change your whole diet. That's where most of us are going to not do so well, or we're going to get overwhelmed. But think about 1 or 2 key changes you can target, and then set that goal. Make it specific, make it measurable, attainable, realistic, and then time-bound. So let me give you an example. Because if I set a general goal and I say, I will eat more vegetables, it's not really a SMART goal. It's kind of hard to really measure yourself and hold yourself accountable. Whereas I might say something like, I will limit my intake of red meats to 2 times per week, and I will choose more lean proteins other days of the week for the next 2 or 3 months. So that's just an example, maybe not a good goal for you, but maybe you can think about a more specific SMART goal that works for you and set 1 or 2 of them today. And I also just want to close up and let you guys know that I do work closely with primary care providers within Terros. So if you do get your care at Terros and you are interested in a one-on-one consult, I'm here to help as needed, and you can always ask for a referral, and then I'm happy to meet with you and see how I can help and provide more individualized recommendations. Thank you guys for your time today.
All right, thank you, Jason. Thanks to both of you for your time. We appreciate that. I don't have any questions at this time, but I wanted to give you both the opportunity to maybe share any common questions that you encounter, both with questions around maybe preventing heart attacks and strokes, or taking preventive measures at home for you, Dr. Gomes, and then Jason, for you, talking a little more about maybe specific foods. So I know my family members would ask about peppers and bacon, so kind of how those types of things fit into, we hear a lot about specific foods contributing to or detracting from heart health. So maybe those 2 questions to kind of start with.
Did you want to go first, Dr. Gomes?
Okay, thanks. And Jason, thanks for awesome talk there. So question for me was, what would I take away as far as how to prevent a heart disease, a heart attack? So I think the biggest thing that comes my way when I see patients is we always think of heart attacks in older people, that we think it's in people who are in 60s and 70s. But that demographic has changed. It's changed that I'm seeing patients who are in their 30s with a heart attack. So the question is why, and what's changed, and what can we do to prevent it? I know we can't completely cure the disease at this time in our juncture in life, but what we all want to do is try and catch it early and slow the progression of the disease, so that you may have symptoms of an artery blocking off and giving you chest pain, but not to the point of a heart attack. So there are lots of different risk factors for heart disease that progress to heart attack. The main ones, as I mentioned earlier today, are the smoking, the diabetes, the not having much activity, the diet, and the weight. Those are the main things that we as providers say that we can try and prevent. Now, those are the main things. And there are some other categories as well that we didn't think of before. And cholesterol is the other main one. And there's some other things that we didn't particularly focus on before, which are more secondary causes that we can change, are things that we call metabolic syndrome. So that's looking at not only it's looking at your abdominal girth, looking at the weight. So looking at those things that likely triglyceride level, so putting in some of what Jason talked about. And that is a risk factor on its own for developing coronary disease. If somebody has inflammatory disease like rheumatoid arthritis, that is now also a risk factor. If somebody had just something that we call gestational diabetes or gestational hypertension, that means that you had high blood pressure during pregnancy, but it went away after, a few months after the baby was born, or you had diabetes just during pregnancy. Those are now risk factors for developing coronary disease for the future. So I think our goal is start finding the risk factors that we might have. And to do that, we really have to then have the onus on ourselves as people to go to our checkups on a yearly basis. And that's hard sometimes, right? we have work, we have family. I feel well. Why do I need to go to see the doctor? But it's because those things that you can find out that you might have, that we can control, are things that may not give you symptoms. Your blood pressure, maybe running high, but you may never know about it because you only have symptoms of suddenly 160, 170. We don't want it to get that. Your cholesterol numbers, it may be slowly going up and you don't know anything about it unless you go for your yearly checkup. Again, blood sugar. If you're having type 2 diabetes, slowly going along, don't know you have it, unless you go for checkup. So once you know you have those risk factors, then you as a provider can get together and see the best way of controlling it to lower the progression of disease. And then comes, what else might be going on? If you have high cholesterol, it's not just going to be a problem for having a heart attack. It's also an issue for stroke. So you want to keep your goals to where you want it to be. A few years ago, we used to have this one target for the bad cholesterol LDL, but that's not the case now. Depending on whether you smoke, what your other condition that you have, we target the bad cholesterol LDL for you individually and target it that way. So it's not, oh, it's got to be less than 100 or it's got to be less than 130. We try and put what other things that you might have and get a number as well. And there's another risk score that we are starting to use. It's called the ASCVD score. And that's more targeting your age, your gender, whether you smoke, whether you are using a blood pressure medicine, whether you are on a statin for your cholesterol, and whether you're using aspirin as well. And that risk scorer, I try and do on my patient when I first see them, and I get the lab work, and then on treatment, and check it again with the blood pressure and cholesterol numbers. That risk scorer, we want to get less than 5%. Sometimes when you see on paper before you do that risk score, you think, oh, you know what? I'm all good. My blood pressure is running in the 135, 140. That's not bad. I even hit 120 sometimes. And my cholesterol looks pretty good. Then it's like, oh, it's 7.5 to 8. But look, if I tweak my blood pressure medicines, I tweak my cholesterol numbers, I can get it down to 4.5. That's a yes, that's what we want. And doing those early can prevent you having a heart attack, or you start having some symptoms of chest pain, but we catch it early. We do the testing that we need to either treat with medicine or open up with a stent in a controlled environment rather than the sudden symptoms, ER, and emergency procedure. And again, with stroke, I would say those risk factors are there. The main thing is, number one, finding the risk factors. Number two, if you get symptoms, if it goes away, don't think, oh, I had that numbness, but it only lasted like 5 minutes. I'm all good now. Remember, that could be a warning for future events, because those little events of brain numbness is what we call a mini stroke, or a TIA. TIA stands for transit ischemic attack. We don't want those, nor do we want the big one that's going to make somebody incapacitated. So I think from my standpoint, I think that kind of trend is what I would go
with. Okay, thank you. So it's really key to work with your provider to identify your risk factors and be able to take action around those.
Yeah.
Okay, thank you so much.
You're very welcome.
All right, Jason, I'll ask you. So any specific foods that you get asked about frequently when it comes to heart health? And Jason, you might want to turn your video off. I see that there's a little bandwidth issue there so that we can hear you better. Okay, it looks like we might have lost Jason's connection to us. So I'll just keep moving on. Oh, hi, Jason.
Okay, I didn't quite hear your question, but from earlier, you asked me what is a common question I get from folks. So the thing that comes to my mind is more of a comment. I hear a lot of folks that will say, well, I'm trying to cut down my sodium, my salt, and then the conversation ends there. That's their last comment. But as I mentioned, a lot of other things I look for in a healthy diet. Frankly, I'm more questioning, are they eating fibrous foods in their diet? Are they getting some of those essential fats we need in the diet? Are we getting different sources of potassium, magnesium? All things are important for our cholesterol, for our blood pressure. So if we're just watching those and keeping it low, but we're not paying attention to those other things I mentioned, I don't really know that that's going to help much. So I don't want people to focus too much on the sodium and other things in our diet we should be talking about and be mindful of.
Okay, it cut out a little bit. Do you want to try turning off your video and just restating? I just want to make sure that we captured your comments.
Okay, so a little bit clear. Okay.
It's still a little bit choppy. I'm sorry. I think we're losing our optimum time for bandwidth. I do want to capture what you were speaking about as far as having people just kind of comment about cutting salt in their diet and not getting other aspects taken care of as well. So I think we can do a follow-up email to our attendee list as well to help address that question. But I want to thank you both for being with us today. It was really great to have you. We appreciate the partnership with American Heart Association on this important topic and getting the word out. So thank you so much, and thank you for the folks who were able to join us, and we'll look forward to sharing this recording in other places. Thank you.
And thank you. Thank you very much.
Thank you all.